Good day to all of you. I am Dr. Devika Gunasheela, and with me is Dr. Aparna, one of our senior consultants in our hospital. We welcome you to the another episode of Ask Gunshila, and this is the 38th episode. We're coming back after a small break because of this COVID situation and the lockdown, etc. We also took a break because we wanted to understand the COVID situation a little bit more, understand the vaccines, and it is still an evolving condition. The virus has only been around for the last, shall we say, now as we know it, for 1.5 years, and 1.5 years is too short a time for any definite conclusions to be made. So we have studied all the various guidelines brought about by the various international bodies and our own national bodies with regards to pregnancy and infertility. And there are plenty of questions that people are asking us. And we would like to, in this episode, give you the facts and bust the myths. So this is what this episode is going to be about. This is going to be the COVID vaccine and fertility, and Dr. Aparna will be, giving you a lot of truths and facts about the same. So, welcome, Dr. Aparna. I also would like to tell you that this is mainly meant for the lay public and definitely not for the doctors. Aparna, there are several myths surrounding the vaccine now, as well as the infection. So, I would just like you to, tell us a little bit more about COVID-19, just in brief. What exactly happened, how it happened, and where we are at this point of time now.
Yeah. This COVID-19, that is coronavirus disease 2019, it all started in somewhere in September 2019, where China, like by the end of December 2019, China alerted WHO that they are seeing many cases of pneumonia, and they named this new virus as COVID-19.
Yeah.
Then WHO itself declared by 31st of January that it is something called like international health emergency, and by the March 2020 it declared this is a pandemic.
Yeah, it was called the SARS-CoV-2, right?
SARS-CoV-2.
Yeah.
And that is where we all started panicking and started taking measures how to stop this pandemic.
Yeah, yeah, and we've come a long way from there, and some data has come out. So is there any effect on? Let us talk about fertility as such. So, is there any effect on male fertility if you do get the infection?
Yeah, initially when this virus started coming up, there were many papers which started highlighting that this virus mainly causes male infertility too. How this, I would like to brief a few this thing like mechanism how this virus acts. This mainly goes and attaches to one of the receptors called ACE2 receptors,
Mm.
which is present in our alveoli and respiratory system, also in the reproductive tract of both female and male.
Right.
So when for that matter, for any infection which is an acute in phase, it causes some semen abnormality and causes sperm parameters abnormality, but it is all transient.
Yeah,
So similarly,
I think any viral infection actually can produce abnormalities in the sperm parameters, and then we do see patients coming and telling us that, oh, I was not feeling well for the last 2 weeks. I mean, it may not necessarily be. I mean, every fever right now is attributed to SARS-CoV-2 at this point of time, but then otherwise also you can always get viral fevers, and when you actually do it immediately after the viral fever, definitely
Definitely.
the semen count comes
Yeah,
down or the
but
motility
the
is affected.
same men, the semen parameters were repeated after 4 to 6 months, and
Uh-huh.
it was shown that most of the men, the semen parameters had gone back to normal.
Yeah, so it really does. Even if there is an effect, it's only, like you said, short
Yeah,
and
short phase.
transient. Now, what about female fertility?
Actually, it is still ongoing research, but by COVID virus as such, the infection at present it has not shown any effect on female fertility. But again, a myth is going on that in the social media, will this COVID take by COVID taking COVID vaccine, will it cause any increased risk of infertility or miscarriage? But I would like to emphasize that this vaccines are all inactivated virus vaccines, or it's a vector-borne vaccines which goes and attaches to your host cells, like increases your immune response to fight against the infection, but it definitely doesn't cause any infertility or high risk for miscarriage.
Yeah, it is only a vaccine, like if you have, like any
Any
meningococcal vaccine or pneumococcal vaccine or any other vaccine, it doesn't produce the disease.
mm,
It just helps you to fight it.
fight
So that's
against it.
what the vaccine is all about, whether it is the Moderna, or whether it is the
Pfizer.
Covishield or Pfizer or Johnson and Johnson or Covaxin or whatever it is. They all have different mechanisms of working and action. But then finally, at the end of the day, they're trying to protect you from getting the condition
Infection.
infection. And even if you do get it, the symptoms are going to be very,
Very
very
mild.
light or mild. Yeah, correct. So that is a myth that we have now busted, that that COVID-19 vaccine will cause infertility or miscarriage. It does
Does
not
not. It is
do it.
absolutely safe in
Yeah,
reproductive age group women and men.
yeah. So all the bodies, you have the ASRM, Foxy, and SRA, all of them saying the same
Saying the
thing.
same thing.
Right. Now, when can women take the vaccine? Is there
Yeah,
any specified time, or can they take it any time at all?
this is another myth which is running all over the social media. Like, women take vaccine during periods? They should not take vaccine. They should not take that 5 days before
Hmm.
periods or during menstrual cycle or 5 days after menstrual cycle, that their immunity will be hampered. But there is no such scientific evidence. Any women more than 18 years, irrespective of the day of periods, definitely they can go ahead and take vaccine.
Yeah, I mean, they say that 5 days before the menstrual cycle. I do not know why they're saying after the menstrual cycle. I don't see any reasoning in that. 5 days before, is it because maybe they may be pregnant? But then I think a lot of the bodies,
Mm,
international bodies, have said that even if they take the vaccine and they do not know that they are pregnant,
pregnant.
it is still fine. It is okay. Nothing much is going to happen,
Yeah,
isn't
and
it?
it is also told that you need not test your pregnancy test
Hmm.
in case if you want to get
Hmm.
vaccinated, because even though if you are pregnant also, it doesn't harm.
Yeah, so that's a very important thing. There is no particular day of your cycle when you actually have to take your vaccine. And the second thing is that even if you have become pregnant and you do not know about it and you've taken your vaccine, no need for any panic. Nothing is going to happen. You should be all right. Right. Now, what about producing? Okay, so we're talking about now. Suppose a patient doesn't know that she's pregnant and inadvertently has the vaccine. Uh, so is there any problem with the
No,
DNA or the?
again, as I told before, these are inactivated or vector-borne vaccines. This will not go and alter your DNA material, or it doesn't increase the congenital anomalies to the babies. But many of the studies are based on this Pfizer and Moderna vaccines,
Mm.
mRNA
Which are
vaccines.
the mRNA and
This
yeah.
Pfizer and
Mm.
Moderna are mRNA vaccines, and already these trials has been done in pregnant women,
Mm.
and it is shown that it has not increased any risk to the pregnant women or
Yeah.
the
See,
babies.
the thing is, we can't have trials of, shall we say, tens and thousands of women, because this vaccine is very young, and the virus, the infection also has only been around for the last, shall we say, 1.5 years. So with whatever evidence that we have and the small numbers of women that it has been tried on, it really doesn't show too
Show
much
too
of
much.
a effect on either abnormalities of the baby or anything else. It doesn't harm you. um, right. So again, we have covered this anyway, so you want to just concise it and tell us in
Yeah,
one sentence.
definitely. If you want to plan your pregnancy,
Hmm.
or if you want to come for any sort of fertility treatment, definitely you can go ahead and plan your vaccination. You need not postpone your treatment, or you need not skip your vaccination for the purpose of planning pregnancy, or if you want to take some treatment. And this is already even given by our own bodies like Foxy and even international bodies.
Yes, 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 yes. Right. um Yeah, now we are coming to see the problem with COVID. What has happened is that after this COVID started, everybody went into this panic mode, including us, because nobody wants to get affected with the virus. But what has happened is that unfortunately, because of our lockdowns, because of scare, because of fear that has been produced, and justly so, a lot of people have been postponing their fertility treatments. Now, if you're young and if you got a good ovarian reserve, that means your stock of eggs in the ovary is fine, then that's all right. That's not a problem. You can still wait. But then there are women who actually may be getting older. So when we talk about older in terms of reproductive age, we're talking about 35 years and above. Although in terms of lifespan, 35 years is still very young, but in terms of getting a baby, 35 years is a kind of a cutoff, and after which you should kind of hasten your process of trying for a pregnancy. So what has happened is, unfortunately, because of all the various factors that the infection, COVID-19 infection, has been associated with, people have been postponing pregnancies. Is that correct?
Yes, ma'am, that is true.
Ah.
If we see that exactly like 2020 in the mid of March when it came, many of the bodies told you should stop fertility treatment, stop planning
Yes,
pregnancy.
yes,
But
yes.
the same bodies by the end of December or November 2020, it redefined its
Mm,
terms and it told, yeah, safely you can start
mm.
fertility treatment. And especially in those women who are above 35 years or even less than 35 years, if you are belong to the low prognosis group, especially if your ovarian reserve is low and you are losing your biological clock, or in women with cancer
Yeah,
affected with
yeah.
cancer, where they have to preserve their fertility as
Mm.
soon as possible. In those women, definitely you can go, we follow all the safety protocols and go freeze your eggs or
Yeah,
embryos.
yeah. So what you could actually do, you can start your IVF treatment. If you don't want to put in your
Yeah,
your embryos before you get the vaccine, fine, fair enough. You can still wait for it, but then at least don't miss the bus by waiting and then losing your stock of eggs, which, if it is low, is only going to become lower as you keep
yes.
waiting. So do take your fertility treatments. If you want to postpone your getting pregnant after the embryo transfer, by all means do so. At least, if you want to, suppose somebody comes at, we say, 36 years, and then, or 37 years, and who's got a low ovarian reserve, we would ask them to come and have an IVF treatment with us, or fertility treatment, or whatever they require, and then freeze all their embryos. And then whenever they are comfortable in their own minds, if they say, okay, I want to wait for the pandemic to get over, whenever that is going to be,
Yes.
which is anybody's guess, then they can, at least they have 36 or 37-year-old embryos. And if they're going to be 38 by the time the pandemic gets over, or whenever they are comfortable, we're not taking out 38-year-old eggs. So younger eggs are better. So don't postpone your fertility treatment for any reason, because it is quite safe. Also, I think you can have, are we coming to the vaccine part of it?
Yes.
Yeah, okay, so we will talk to you about that. Yeah, here you are.
But one advice what we would like to give is, please avoid any sort of treatment 1 week before or after you take your COVID vaccine. Because when you take COVID vaccine, there are some side effects like fever, mild headache, irritability, body ache. We don't know is it because of these treatment or because of the COVID vaccine.
Yeah, also sometimes what we have seen is that people have taken their first dose of vaccine but have also turned COVID positive.
Yes.
And that, I want to be absolutely clear, it is not because of the vaccine. It is because they were infected even before taking the vaccine, and the presentation of
Was
the
late.
symptoms, that is their fever or myalgia or whatever they had, coincided with the date of the vaccine. That's
Vaccination.
all. So
So if in case if any of these symptoms, if it prolongs for more than a week, please get your COVID test done, RT-PCR done, and make sure that you are not infected.
yeah, so one more, we want to reiterate, the vaccine does not produce COVID infection. If you do test positive after the vaccine, it most probably is because you have had an exposure even before taking the vaccine, and your appearance of symptoms has coincided with that vaccination
Vaccine.
date. That's all. There's nothing else about that. So I hope we are very clear. But then, but you have to look out for certain side effects, and those are quite common in most people. Actually, I had a lot of myalgia and fever, etc., when I took the first dose of the vaccine. The second dose was fine. Right. So coming on to the next.
Yeah.
Yeah, please tell us
Many
about
many
this.
women come and ask, I took my vaccine and in
Hmm.
the same cycle I got pregnant.
Hmm.
So what should I do? Definitely, you can safely continue your pregnancy. You need not go opt for medical termination of pregnancy, because you can see some of the vaccines like we give routinely tetanus, diphtheria, pertussis vaccines. These are again the inactivated vaccines, and some women might require hepatitis B vaccination in
Hmm.
pregnancy, meningococcal
Hmm.
or
Hmm.
pneumococcal or flu vaccines.
Yeah.
All these are again
Inactivated, just like our
Yeah,
Covaxin, right?
definitely.
Yeah, so that is one thing. And the Covishield is against the spike protein, so it is only against part of
Part of the
the
virus.
virus. So it's not even an inactivated virus.
Mhm.
So I don't think you should worry at all
Oh,
about this. Like, all the ones that have dots are all the inactivated vaccines
yes.
which we do give in pregnancy.
Pregnancy.
So they're totally safe. It's okay. There's no problem at all. So you don't have to get worried.
In case if you are coming for the treatment,
Mm.
definitely you need not panic, because we follow all the safety protocols. You are in safe hands, and we do test RT-PCR COVID test in before planning any sort of treatment, any invasive procedure. We do your testing. Even in case if you come up negative only, we will proceed with the treatment part.
Yes, yes. I mean, unfortunately, this has become the norm. We have to kind of keep testing,
Yeah.
and testing also is quite uncomfortable. It's quite an uncomfortable procedure, but it is for your safety as well as ours. Now, can you tell us about the efficacy of the
Yeah,
vaccine? What
again,
exactly
this
does
is
it mean?
this is one again the common question: which vaccine is more
Mm,
effective?
mm,
Either it is Covaxin, Covishield, or Sputnik. So almost you can see almost all the vaccines has similar range of efficacy.
mm.
Efficacy, it means that in case if you get infected in future, this percentage of amount of infection, you will have a milder symptoms. Like in case if 80% efficacy, you will have 80% reduction in the symptoms.
Yes.
It doesn't mean that you will get 80%, you will not get 80% infected, or 20% you will get in chances of getting infection
So what you're trying to say is it means efficacy means that you're going to have a reduction in
in
the symptoms.
symptoms or severity.
It is not saying that you will never get the
Yeah,
infection. Okay, it doesn't mean that 80% won't get the infection, 20% will
will
get the
get, yeah,
infection. If you say it's an 80% efficacy, what it means is that there is 80% reduction in the
the
symptoms.
symptoms.
And quite often, I have had people in my own family who have had, in my relatives who have had the second dose of the vaccine, and after which they did get infected, but it was extremely mild. I mean,
Mild,
there was it was
yes.
almost kind of asymptomatic. So it's a good thing to take the vaccine. So
Vaccine.
please go ahead and take the vaccine wherever it is available. You must stay safe, and you must protect yourself,
And
because
whichever is available, so
yeah,
don't wait for a particular vaccine to come.
yeah,
So whichever is available, please go ahead and take.
yes. So yeah,
Also, these like women with hypertension, diabetes, cancer, or HIV infected, or any high risk group with
yeah.
any comorbidities, they'll come and ask, can I take my vaccine? Because already I am at a high risk group, will taking vaccine will increase my symptoms? So definitely not. Actually, in fact, these people are the high
Once,
priority group.
yeah, they are the ones who have to take it
Yeah.
rather than healthy
Agree.
bodybuilders, isn't it?
Because if you get COVID vaccine in your pregnancy, you're very fragile group, high
Yeah,
risk pregnancy. You belongs to a high risk pregnancy group, because in pregnancy again this COVID symptoms will get exaggerated.
yeah.
So the you people are the most important group who has to first get vaccinated.
Yeah, and anybody having men or women who are having comorbidities. So,
Please do take.
comorbidities is an indication for the vaccine. Please don't think that, because I have diabetes, or
Yeah,
because I have a heart problem, or because I have, high blood
high.
pressure, I should not be taking it. No,
Mm,
you are the ones who are the priority, and you have to take it.
true.
So I hope that myth has been busted now. And tell us about
And
this.
some come and ask, already I have
Mm,
got my COVID infection recently or in
mm,
the past,
mm,
and still should I take my vaccine or
mm,
not? See, if you get infection, it is a very short term protection. Like
mm,
there definitely there will be antibodies produced in your body, but it is a short lasting. But if you take vaccine, it's
mm,
a long term protection.
mm.
So you should know this, irrespective of your past infection. Definitely you should go ahead and take your vaccine. Maybe you can wait for another 6 to 12 weeks
Mm.
after you
I
got
think the
tested
current,
positive.
yeah, I think they're saying up to 60
Up
days or
to,
something.
yes,
You have
ma'am.
to wait 60 days until after your infection
Infection.
before you can take the vaccine.
Yeah,
But you also need to take the
take the
vaccine
vaccine.
even if you have been infected.
And some comments say, I took this, as ma'am already told, I have taken my vaccine, and it resulted in RT-PCR positive
Yeah.
COVID. It gave me COVID infection. So
Yeah.
definitely these are again inactivated, or this infection, this vaccine doesn't cause any viremia.
Yeah.
So to get you the COVID infection.
This vaccine, it does not produce the infection. It's not going to sit in your throat and say, okay, produce your
Mm.
RT-PCR that is going to be positive. It is only going to increase your immunity towards the
To fight
infection if you
against.
do get it. So please take the vaccine. It does not produce the infection.
So this
Right.
is
Huh.
again a common thing. I took my vaccination. Should I follow these three golden
So I'm
rules?
okay.
Yeah.
I don't need to do this. Wrong.
Wrong
Completely
again.
wrong.
Yeah,
Yeah.
definitely. You should wear your mask,
Mm.
and you should sanitize your hands regularly and maintain the social distancing.
Like we have said, the vaccine will help to decrease the symptoms of the COVID infection. It will help to prevent it, or prevent you from getting to a certain extent, but that is all the capacity the vaccine has. But when somebody does get COVID infection, if one has to have it, we'd rather have an asymptomatic or a very mildly
Milder
symptomatic
symptoms.
one, rather than going to the stage of getting into an
Yes.
ICU with all its 101 complications. So really, the mask is here to stay. People should wash hands and you should maintain social distancing. These are the things that we will not be getting rid of very easily. These are the mainstay of preventing yourself from getting the infection. So this is here to stay. Actually, when I went to Hong Kong some time ago, I used to see in the hospitals, every place they had hand sanitizers, and every place wearing a mask. This was in 2011 or 2012, and wearing a mask was a mainstay. Everybody was wearing a mask. If they came to the hospital, though, it was even more prevalent of wearing a mask. And
Mm.
it's the thing, why are they wearing a mask? And I think they were the ones who were hard hit with the H1N1 and all these various
Yeah.
other flu outbreaks
Mm.
that came in. So that will become mainstay. Right.
So we hope that we have answered your most of your questions, and we have broken like many myths regarding vaccine and fertility. We have taken our vaccine shots, so hope you plan your vaccine soon. Don't miss your shots.
Yeah, please take it. There is shortage, but now I think the government is
Yeah,
pulling out all the stops and trying to get the vaccine available anywhere. And don't say, I only want to take Covaxin, I only want to take Sputnik. Whatever is available, you please take.
yes.
And
And we all the healthcare workers more than 18 years, we all have got
yeah.
vaccinated. So hope all the more than, I mean, all people more than 18 years, please plan your vaccination and join the fight. Please
Yeah, I
stop in
think,
spreading
I
this.
think, I think one of the key ways to stop this pandemic, or at least decrease its spread, would be to get vaccinated.
Yes.
So do join the fight, and please get vaccinated. Whatever vaccine you get is fine. Just get vaccinated, and stay safe, stay healthy, and most important is staying positive
Positive.
through this whole period. And it will pass. Everything does pass. There should be sunshine after rain. There should be laughter after pain. So it's just a question of hanging in there.
Thank you.
And thank you very much for staying with us. And the
Any
next talk is going to be about COVID-19 vaccine, pregnancy, and
I'm
breastfeeding.
breastfeeding.
So that will be done by me and Dr. Rajamurli, who's another one of our senior consultants. So do join us then. And like we said, stay safe.
Yeah, any questions, please put it in the comment section or ask at gunshila.com. We are happy to answer any questions.
Thank you.